Hello guys, I hope all of you are doing well. My name is Sheena Bansal. So today we will start practice tips. What are these practice tips? See, I will only talk about relevant points which are relevant to your AMC examination. Okay. So first of all, if a patient comes to you and effusion of the knee is absent, absence of effusion of the knee does not indicate that there is no severe injury. There may be severe injury and comes to you. Second is, if a patient comes to you with knee pain and you examine the knee and there is examination of the knee is normal, examination of the knee comes normal, then you have to check the lumbar spine examination and hip examination. You have to do the lumbar spine examination and hip examination. Examination of the knee comes okay. It does not mean that there is no abnormality of hip and lumbar spine. There may be any abnormality of lumbar spine and your hip, and maybe the pain is referring to the knee. So your first point is absence of fusion of the hip does not indicate that there is no severe knee injury. Second point is, if your knee examination is normal, it doesn't mean that you have to check that, it doesn't mean that patient is okay. You have to examine the lumbar spine and your. So your third point is, if a patient comes to you, he's a young boy, if he comes to you with severe night pain in the bone and which get relieved with aspirin or paracetamol or other NSAID, you have to think about osteoidostoma. If patient is having night pain, he's a young boy and it gets relieved on with NSAID or paracetamol or aspirin, anything. Your fourth point is, meniscal tears may happen without preceding trauma in the middle age. So a patient comes to you with no history of preceding trauma, and there may be meniscal tear. So meniscal tears can happen without preceding trauma. This is your fourth tip. Presents to you, it's the fifth tip. If a patient presents to you with history of audible pop with immediate effusion and history of preceding trauma, then there is ACL tear until proved otherwise. And your sixth tip is hemarthrosis of the knee with history of preceding trauma indicates ACL tear until proved otherwise. Fifth is audible pop or crack with immediate effusion, ACL tear, and your sixth point is hemarthrosis of the knee with history of preceding trauma. Your seventh point is movie theater sign. If a patient is taking the seat to stretch the knee, this is due to your patellofemoral pain syndrome. So you have already gone to cinemas and you have seen the chairs. He is taking that chair to stretch the knee. This is due to patellofemoral pain. Eighth point is, when your knees touch while in bed and you have pain, this is due to medial meniscus cleavage tear. When you are in bed and your knees touch, this is due to, and you have severe pain, this is due to medial meniscal cleavage tear. So we have done 8 points till now. See, next is your ninth point is a positive squat test. You have medial pain on full squatting, then you may have tear of posterior horn of medial meniscus. Your 10th point is, you should not perform aspiration on an athlete having acute knee injury. A patient comes to you with acute knee injury and you don't have to perform aspiration procedure. What we have done, your 9th point is positive squat test, and your 10th point is never perform aspiration on acute knee injury patient. So if an old female presents to you with severe pain on the knee, and you must think of osteonecrosis because she is having old age and she is having severe pain, think about osteonecrosis once. And we have done 8, 9, 10, 11, 12th. Your 12th point is, don't give corticosteroid injections in cases of osteoarthritis and acute inflammation and diffuse inflammation. So you have to reserve your corticosteroid injections for rheumatoid arthritis patients and your crystal arthropathy patients, rheumatoid arthritis patient, reserve for them your corticosteroid injection. So your point is, your bursitis, tendinopathy, they respond well to local anesthetics and injection of local anesthetics and corticosteroids. So you have to give the injection, but never give the injection into the tendon, especially the patellar tendon. So your 13th tip was that, and your now 14th point is about autologous cartilage implantation. What you do is, you take the chondrocytes or cartilage cell from the patient and multiply in the leg and then implant in the joint, especially the knee joint. And especially you do this for the osteochondritis. So these were all 14th point total for the knee joint. These are very important points you have to remember for your AMC examination. I will talk only about the AMC examination, as you have to clear first your AMC examination and then proceed further. So with this, I end my session. I think it will be about 5 minutes, so you can easily see this, and kindly send your remarks so I can proceed with other videos for you. Thank you so much.